So I'd like to invite Zainab Senessie, the CEO and Project Manager and Midwife Practitioner. We give all to combat hepatitis and liver cancer. Please give a round of applause for Zainab.
Everybody, welcome to the third day. As she said, my name is Zainab. I am a midwife practitioner in London, project manager, and I move around to bring mobile health to communities, especially in Africa. Today I want to start with a short play, just the caseload of what we normally do when we go out to the clinics. Fenia is one of the members. She's from the Netherlands, but we work together, so we move around a lot. Hello, Fenia. Hi. Do you want to take a seat? Thank you for coming. You had your blood test this morning. Yeah, I did. And I just want to discuss the results with you. And we prepared you for this. We talked about hepatitis, infection that you can develop through. We gave you the transmission modes, how you would get that. And we found out that you have hepatitis, infection.
What? What kind of sickness is that? How did I get it?
Hepatitis, like my colleague discussed with you before she did the test, is an infection that can affect your liver.
Does this mean that I won't be able to eat liver again?
No, you can eat liver. The human liver here on your right side is what's infected by the hepatitis infection. And like we said, some people don't have any symptoms when they have hepatitis.
Because I don't feel sick. I'm very well.
I know, that's why we go around to educate you that come for this screening whenever you see us around the villages, come around so we can test you. Now you need to bring your friends. If you have a partner, you go and pass the word round, bring them so we can educate them and we can screen them too.
Doc, this thing you are saying, I don't know where to start because my partner is not one. They are meaning, so I don't know who I'm going to ask to bring. But I'm so surprised right now with this sickness. This sickness is so big.
If you're able to I know, no, it doesn't kill you, not immediately, that's why we're here. We try to prevent so you don't get to that stage. And if you're able to talk to, did you say many partners?
There's so many of that, I'm so ashamed right now, 7.
I'm sorry, but you try and convince them, try to bring them, because that's why we're here to educate you. And we're going to be in the room, nobody knows what they're coming for. And we take it in turns.
I'm too worried right now, Dad.
We'll come back and talk to you.
I'm just going to get him because I want to make sure who gave this to me.
We'll talk to you after the clinic, okay? Thank you, Fenia, for coming. Like we said, that's just a little case that, like the case studies that we come across. It's like 3 we've put together in this one because of time and make it really short. But when we go out there, we usually meet young girls that are just having fun. They have lots of partners, and you come and tell them about hepatitis. Some of them don't even know how to pronounce hepatitis. And now you're there to educate them through how the infection is transmitted. There was another lady when we said to her, this is an infection that you get in your liver. She was worried that she may not be able to eat liver again. We said, no, you don't get it by eating liver. It's an infection that sits here. So we talk about the anatomy, we talk about the physiology. You cannot talk about hepatitis without telling them what the organ it affects. So that's why we had that little scenario just telling her where her liver is situated. Like we said, universal health coverage. I really love what the panel that just finish what they talked about. Because that's really what we thrive for, bringing the care to the most needy. So we travel around to educate, to make sure the health coverage is actually universal. And we really do not want to leave hepatitis behind. We've touched on anatomy and the physiology of the liver, like the functions of the liver. We know how important the organ liver is in metabolizing the medication and getting rid of toxic from the body. So it's really important that we look after our liver. We touched on that already, location of the liver, the anatomy. And what the liver does for your body. Again, because of time, I'm not going to read through all those, and we'll just share links afterwards. Most of this information we get from the World Health Organization website. We get from the World Hepatitis Alliance website. So it's about spreading the word. If somebody asks you about hepatitis, if you cannot remember what to tell them what it is, you could always please just refer them to those websites. It's just more information on the liver function. What really we want to get into is what our organization does. That's just a picture of the liver, a healthy liver, when you're infected with hepatitis, the scar tissue there we call fibrosis, how that can develop to cirrhosis if you don't get the right treatment, and eventually liver cancer. That's what I try to explain to my colleague, and when we out there, it's really difficult how to break these terminologies into a language that they understand. And when people talk about hepatitis in the communities, really they think of HIV, the stigma is huge, because most of the medication, almost all the antiretrovirals they use, are the ones used for HIV. So as soon as you mention hepatitis and you say you could contract it through sexual health, they kind of disappear like failure did. And most times, we're not able to get hold of these patients that we meet out there to further educate them. Some of them is because we don't have contacts for them. Some of them because of costs. They can travel back and forth to the clinic to seek help. So you tell them they are positive. You cannot follow them up 6 months later. We just lose them. Hepatitis is a huge topic. We've got 5 main types of them, and we focus on hepatitis B, because that's the most common one we see when we go to Africa. Unfortunately, that's the one that's preventable by vaccination. 99% effective vaccine for Hep B. So that's the one we focus on mainly when we go out there. And the other reason why I focus on hepatitis B is not just because there is a vaccination for it. It's also because my father, he died of liver cancer from Hep B. That was not diagnosed on time. We only found out that it was hepatitis B when he already had cancer. So he came to the UK. We were just desperate, like, this is my hero. No, this is the one that motivates me. This is the one that says, you can do it. Every morning I wake up, I feel so down, like going to work, you just think, oh, today I don't feel really well, I may not want to go to work, I'll call my dad, just to say hello, and he lifts me up. So we just suddenly hear that, like, our dad is dying. He's got like 3 months. I said, no. He can come here, I was desperate, I'm going to give him my liver. And we're just going to have surgery, he's going to be fine, he's going to have a liver transplant. We were just desperate. So he came in 2015, and he was admitted to the King's College Hospital in London. Like I said, he only lasted 3 months. He came in September, and sadly he passed December, and then I built more interest. I'm just going to move on this that I said because of time, I could just read from the website, because I really want to go into what our organization, We Give All, does or tries to do. Fenia did mention that she feels really well, which I was saying to her. Most of the patients, hepatitis patients, do not feel ill at all. They don't have symptoms. The very few that have symptoms, we kind of touched on that, and she was asking, oh, what happens next? She was upset when I said that it could be through maybe sexual intercourse, it could be through blood transfusion, but in her case, because she's never heard of hepatitis before, she's worried about what's going to happen next. All she focused on was the boyfriends. She said, oh, my partners, I have lots of partners, who am I going to bring for screening? Who gave this infection to me? How did I get it? So it's just about that education and reassuring them. And somebody mentioned about trust, about continuity. If we're able to go back, keep going back to these people, we should be able to follow them up. Because like I said, when we travel back to the UK, it's usually very difficult to get hold of them because some of them don't have phone numbers. Some of them cannot even afford to travel back to the clinic. Some of them because of the stigma, like she was telling me she's shy. She said, oh, what am I going to do? I feel so ashamed because I think it's because I have lots of partners. So for many reasons, we lose these people when we go out of the mobile clinics. They usually do not come back for the above reasons. Just a picture showing what the normal color compared to jaundice. We mentioned the treatment that some of them cannot afford in Africa. There are all the options for treatment. Some people full-blown infection. If you're really unwell, they cannot afford medicines. Instead, they will just be taking painkillers. We mentioned vaccination. And I touched on why I am doing this. Our organization, like I said, we go out, we educate, we raise awareness, we encourage people to get tested. But when we go out to, especially in Africa, to the clinics when we screen them and we're not able to get hold of them, they're not able to come back, for example, 6 months later to come and repeat the test, it becomes really, really difficult for us, and it's heartbreaking because those that are negative, we educate them about vaccination, but they cannot afford it. And we cannot afford to go back and vaccinate all these ones that we've said. The best way to prevent it is through vaccination, because it's quite expensive. It's because of costs that we cannot reach everyone. And we're hoping what we're doing is to complement the World Health Organization's work in trying to raise awareness about testing for hepatitis, about vaccination, and those that are positive, how they can access treatment. The previous panel, they used lots of words that normally is what we thrive for. All this collaboration that we are hoping for. We want to team up with such innovators, they call themselves, visionaries. I love that. I think we can refer, like you said, to us, the job that we do as innovators. We bring all these ideas to them, but because of cost, it's like they're really restricted into what we do. So what they said there about trying to provide the universal health coverage is what we are hoping for, to find people to come back there to actually come and tackle it, this hepatitis from the grassroots. Because, for example, my father, he wouldn't have come to London for treatment. He loves his country, we are from Sierra Leone. In fact, I had to convince him. It's because I said to him, Baba, you're going to have transplant. If it's a match, I'm going to donate my liver. But he has respect for the medical professionals there. The problem is equipment, the medicines do not reach. Most of them, they train like from Europe, from America, and they go back home to provide care. Most of us, we go there, we've trained in the UK, we go back to Africa to provide care, but we don't have enough resources, the facilities don't have equipment, you go there without the vaccination. Even if you go to vaccine, because of electricity, sometimes you don't have refrigerators that work properly to store your medication, so the challenges are many. So the previous panel, those are the people that will say, can you encourage more people that can come and team up, that can bring the care to Africa, especially in the area of hepatitis, infectious diseases, and try and tackle it from the root cause. That's what we try to do. That's just part of our aim, to educate, prevent hygiene. We go out to the schools. When we're there, we go to the workplaces. And we do a lot of work in the UK as well. What we are campaigning for now is to encourage the GPs. If we could come around and maybe educate their patients and ask them to include the Hep B screening. I know they're doing A&Es now. I'm not too sure what the GPs do, but that's the current thing that we are working on, to encourage the GPs to include the hepatitis B screening when they do the new immigrants in the country, because they do HIV, and you can just have the vial and add Hep B on that. When we say catch-up vaccines, we're looking at families like those that have children born before 2017, because in the UK, they only started vaccinating from babies born from 2017 to all parents. Before that, as midwives, when we screen women and they are positive, we kind of focus more on that positive woman, and we don't have enough time to educate those that are negative, if you understand what I mean. And when the babies are born before 2017, we vaccinate babies that are born to mothers that are Hep B positive. So it's like those that are negative, we are not doing the prevention, we're not vaccinating them. We just let them go, we're not educating them, because first of all, time. As midwives, you are in the clinic, you have like 20 minutes to see a woman, talk to her about her pregnancy, talk to her about the next stage, talk about plans and all that. Talk about diet, nutrition, hot on the topic, we do that a lot, detoxify the liver. So it's lots of very useful information I've gathered from here, and lots of good networking opportunity. So by the time you do your 20 minutes, like hepatitis is so neglected, very important topic. This woman will have, for example, 3 more children at home that were born before this baby. This baby is going to be vaccinated. What about the older siblings? For example, you take them to Africa, let's just have a scenario, and one of them contracted Hep B. They'll come back and say, oh mom, why was I not vaccinated? So that's kind of heartbreaking. We go around and educate them that let's try and make sure we catch up with these vaccines, get the older children vaccinated before you travel. Because it's heartbreaking that you have only one child the government has funded, they vaccinated her, she's fully, or he is fully protected, but the older ones are not. Some of these parents can afford the vaccine, but it's the knowledge, the awareness is not there. So we go around and just make sure everyone is aware. I think we touched on that before. I actually brought the slide on, trying to work with like-minded people like the ones who met here. So how we do it, again, I've touched on that, going around, talking to medical professionals, talking to other healthcare professionals in clinics, in hospitals, mobile clinics, like I mentioned earlier, schools, workplaces. Even in your office, you could just talk to somebody there about hepatitis. I'm not sure how the topic will come up, but if it does come up, you could refer them to any of the websites that I mentioned above, the World Health Organization, the World Health Alliance, and they can educate themselves. They just need to be aware where to find nutrition. When we do our events, Africans, they are really like playful, we are very chatty. We don't like to do events without food, which is where the diet and nutrition comes again. We don't like to do events without music. So we usually hire like big halls and just have fun. We bring the DJs, we bring entertainment into the room. People learn that way. We do drama, we do a lot of drama. Because of time, we couldn't do much. And if you visit maybe our YouTube channel, the link that will show later, you see some of the plays that we put up because people learn in different ways. Some people get really bored with just reading. So when we go out, we usually do like scenario, short plays. We touched on the barriers, the challenges that we have when we go out into the community. All these outreach clinics we do, the reason why sometimes we are not able to go back is because of funding, the lack of funding, because of costs. All the work we've done, we've captured, we've got some photos. I'm not going to say much, even though most of them have stories behind them, but because of time, I'm just going to scroll through those photos and tell you the year or where that took place. It was launched, again, like I said, in memory of my father in 2017. 28th of July, usually World Hepatitis Day, when we commemorate the day, and lots of countries worldwide come together to raise awareness in hepatitis. And those are my siblings, and that's my dad. This was just the day that we launched it, prayers and a few other pictures, colleagues at St. Thomas's. That's the FGM specialist, because we link FGM in Africa with hepatitis. We think some of them contracted hepatitis from female genital mutilation with non-sterilized instruments. And the lady in the yellow top is a colleague at St. Thomas's Hospital, FGM specialist, so they all came to promote. This one is A&E doctor, now with the Imperial Hospital. Dr. Eugene is a consultant at St. Thomas's. They all came to support us to launch it. Our group is a group of midwives, doctors, colleagues, public members, anybody that's interested are welcome to join. That's just the day that we launched it. Like I said, we don't do things without food, without music, without play. We play, we educate through play. And then the first placement after we launched it was a district called Koinadugu in Sierra Leone. It was funded by the Japanese government through the International Organization for Migration, and they invited me to work there as a diaspora expert in midwifery, just to pass on the education. And obviously we included the hepatitis education in that. So that's just the field area in Koinadugu, 2017, with the IOM. And one of the doctors mentioned forest after all this lovely talk about all these big terminologies of innovation, visionary, and then they mentioned forest. And that made me really smile. I love that because we really do go out far, far out to reach people that really do need the care. The only challenge there too is bringing around people that can translate. It's really a huge challenge too. Lots of multiple baths. I had to capture one of the deliveries that I facilitated. Antenatal education, multiple baths, again the same place. And in 2018, World Hepatitis Day, again in the UK, lots of photos, what we did, educating people and doing screenings. And that's one of the EP Foundation members, Paul Desmond. Colleagues just at the event in 2018. Games, that's our General Secretary there, but we're very passionate about education. We do competition, again, just to engage the public, because people love games, people love winning, so we give a scenario and we encourage them to take part. After the done in the UK, we went to Sierra Leone. A few days later, again in 2018 in July, to repeat exactly what we did in the UK. That's one of the consultants in the UK. And when we push to have this on the agenda, we usually will obviously invite, for example, members of the parliament. I think the reason why this guy was there, because they too have experience. But they can get really busy and they say, oh, we'll send a representative. To have a member of the parliament come and talk, I think it really did touch them. Because when you hear in Africa that somebody is unwell, they've got swollen legs, their stomach is swollen, it's actually usually related to like witchcraft. They don't have the education that because of hepatitis, your organs are failing. They are building all these ascites in your stomach. They don't know that. So these people are desperate to educate the community, and so they join us. Again, in Freetown, with some of the lab technicians. This is the doctor that we work with a lot, Dr. Ramesh. I refer patients to them. That's a colleague, a midwife as well. That when I did the screening in Sierra Leone, I handed over some of the patients that she can follow because she's still continuing a contract in Sierra Leone through the Partners in Health, PIH, a big NGO in Sierra Leone. So between Aisata and Dr. Ramesh, we can refer from UK. We can call them and say somebody has called us from Freetown. They need you to explain the results to them. They want to find out about vaccinations for the family. So we really work very well with these two. Just the admin team when we go around. I think 2018 was the longest we stayed there. We covered a few clinics and just photos from the field out there. I mentioned Kono district where my colleague Aisata is based. After we left, Aisata gave us an update that now the PIH, they are vaccinating all their staff, which is really, really good. And we think that's a huge achievement for us. Whether it's directly from what we brought to them, the education, whether it's indirectly, it just happened, it's a coincidence. We're not sure, but they're vaccinating all their staff now. And they're educating the women, they're screening all the antenatal women that come through their doors. We're not sure how much they follow them up, again, for the reasons that I gave earlier. These women come, they don't have phone numbers, they don't speak the language, they are worried about stigma, they don't want the community to know that they have hepatitis, which they just think is so related to HIV. The stigma is huge. This was in Geneva. Dr. Sida is a consultant surgeon in Birmingham. We've worked together out there, but he does a lot of voluntary work in Ghana now. But this was when we met together in Geneva in 2018, again, to just share our experience and what we do to bring the talks out in the community. He is luckily coming to work with us again in Sierra Leone in 2 weeks' time, because the West African Council of Surgeons, they're going to have the presentation this year in Sierra Leone. So in March after that, we're going to work together again with the consultant, Dr. Sina. These are all college midwives from St. Thomas's Hospital in London. My colleagues are all together. And this is when I took my kids just to show them where we come around to do this. That's why I said charity begins at home. Just to show them this is what we do, you can do it. When mom is not around, can you continue this legacy? Because what I do is what I've gained from my dad, that you need to bring the care to where it's needed. So you need to continue that legacy. That's just them at the end. That's my mom. I didn't know this slide was there. I'm so sorry. No, I just lost my brother last week. I'm really, really sorry. That one, that's my brother. That's my mom. He died last week, and I wasn't. I'm sorry. So I captured him in one of the slides. Those are my kids again. This is where I was actually born, this hospital. So I was blessed to go to there to Kabakwe, to provide care, to educate, to do vaccination. I need to just have a moment of silence for my brother. I'm really sorry. back. And in 2019, again, we went to Sierra Leone, another district we call Moyamba, to repeat the same thing. We go like district to district. We come back, we work, we raise funds, and go back to another clinic. Like every year, we try to do that. Just in the theaters, with the IOM and the neighborhood. Education in the UK. That lady in the green top is one of the GPs in the UK. So we tap into all these people through networking, to encourage her to help us spread the word, to meet with GPs, to encourage GPs to screen patients for Hep B, the newly arrived immigrants. So she is helping us with Margaret, who's our General Secretary, there next to her. Those are members of Wikivote. I think I have like hundreds of slides of just photos of what we do. Like I said, I'll be able to go into all the details of those scenarios. So I'm just going to flip through. That was 2019 in Geneva. Because of COVID, we were not able to go out there, so we just did lots of like virtual education, just so we don't miss out the day in 2020. We had a campaign again just for fun. Those are my kids. I'm just encouraging people to wear yellow. Yellow signifies hope for us. It signifies, it's also the color for jaundice, the hope that one day we will eradicate hepatitis. Again, in 2021, we did another virtual meeting just to commemorate the day. All this is just what we do virtually. And then we went after the COVID, we went to Masori is in the northern part, it's near Kabakwe, the previous one. We went there, we educated people, we screened them, and the challenge again, were we able to follow all of them up? No. In 2022, just the services that we do in Sierra Leone, we're able to secure an office there so that people can come into somewhere that is quiet and private. You heard Fenia was talking about stigma, how, are they all gonna come here, my boyfriends, to have the screening done? Yes, they will all come, but nobody will know what they've come for. They will be coming into a quiet room, somewhere private, and they will come and nobody knows what their results are, so don't worry about that. But we've got an office down in Sierra Leone as well. That was the last trip of 2022 in May, in Bond District in Sierra Leone. We talked about diet, nutrition, we don't talk about food. I cook myself when I'm there and we bring the food to the staff. We make sure we feed them, not just buy any snack out there because they are not in your comfort zone. We provide them with good meal. And it's just, again, for joke, the lady, the caterer that's coming to serve them, just took a photo, just teasing her. We eat anywhere, on top of the vehicles, in your clinic, wherever you can, just quickly to continue. We work harder in Africa, even more than in Europe, because of the time. You're there for like 2 weeks, and you want to do like 20 villages of maybe 200 people. It's really difficult. So as you go, you just munch in the car, on top of the bonnet, wherever. Just some of the labs. And I call the hotels the place of reflection, the haven. In the evening, you just sit there, we discuss cases that we've had during the day, and it's just relaxing, music, good food. And you forget a little bit about what you've had during the day. But look forward to the challenges of the following day. Through the sea, labor ward. When I go to educate, I go to work in the labs. I don't know, just I get drawn to the midwifery so much. If I hear somebody cry in the labor room, I will come there. I'll come there and just support. So sometimes I get a delivery that's not planned. Sorry, like I said, it's so much on the end. Okay, so the most recent event in 2023, we were not able to upload any of those photos or videos, but they are on our Facebook pages, they are on our YouTube pages. We give all, and it will be on the Health 2.0 LinkedIn page as well. We'd like to thank you all for listening to this, for watching the presentation, and would like for people like the previous panel that really want to collaborate with people like us that want to bring the care where it's most needed. So please work with us. Thank you very much.
Thank you very much, Zainab, and deepest condolences to the loss of your family. That's okay. We'll give you a moment for that. Very informative, and thank you so much for educating us on this very pressing issue.